Have you ever woken up, looked in the mirror and noticed your eyes were puffy, your face looked tired, or your body just felt heavier than it should, and you told yourself, it's just age, it's just stress, it's nothing serious? What if I told you that for millions of people, those exact signs were the first warnings of kidney damage, and they ignored them until it was almost too late? Because here's the frightening truth most people never hear clearly. Kidney disease rarely hurts, rarely screams, and almost never gives you a dramatic warning. It quietly progresses in the background while you're busy living your life, until one day the conversation suddenly shifts to medications, strict food rules, or even dialysis. I'm Dr. Johnny, and in my years of clinical work, I've seen far too many patients say the same sentence. If I had known this earlier, everything would be different. The good news in this part matters is that your body doesn't stay silent forever. It leaves clues on your face, your skin, your urine, your energy, even your hands and feet, subtle signals that most people overlook or misunderstand. And when you learn how to read them early, you can still change the outcome. In this video, I'm going to show you the visible warning signs of kidney damage that appear long before it becomes irreversible. Explain why they happen, and most importantly, what you can do now to protect your kidneys while there's still time. So stay with me, because one of these signs might already be showing up on your body today, and recognizing it could change the rest of your life. One of the very first places kidney trouble quietly shows itself is right on your face, especially your eyes. Waking up with puffy eyelids swelling above or below the eyes, or a heavy, tired look that doesn't match how well you slept, is often dismissed as allergies, stress, or aging. I once had a patient who laughed it off and said, "Doc, I just thought it was too much salt the night before." But when we ran his labs, we discovered his kidneys had already lost a significant portion of their filtering efficiency. From a scientific perspective, healthy kidneys tightly regulate sodium and fluid balance while you sleep. But when that system weakens, excess fluid has nowhere to go and settles in the softest tissues of the body. Your eyelids making morning puffiness, one of the earliest visible red flags of reduced filtration. Clinical observations consistently show that fluid retention linked to declining kidney function often appears in facial tissues long before swelling shows up in the legs or hands, which is exactly why this sign is so easy to ignore. And this is the part most people miss. When puffy eyes show up frequently, follow a pattern, or slowly worsen over time, it's no longer a cosmetic issue. It's your kidneys asking for attention. But knowing this alone isn't enough, because there's another sign that often appears right after this one, far more dangerous, and almost everyone overlooks it. After morning puffiness around the eyes, the next sign often creeps in more quietly, and that's the dark circles underneath your eyes. As a physician, I've had many patients tell me, "Doctor, I thought this was just genetics, or that I wasn't sleeping well," and for a long time they truly believed that explanation. But clinically persistent dark circles can signal something deeper: changes in circulation, oxygen delivery, and toxin clearance. All systems that are directly influenced by kidney function. When the kidneys struggle to filter waste efficiently, the blood carries more metabolic byproducts, microinflammation increases, and tiny blood vessels under the thin skin of the eyes become more visible, creating that shadowed, bruised appearance that no amount of sleep seems to fix. Research shows that declining kidney filtration can impair red blood cell balance and vascular health, which helps explain why these dark circles often appear alongside fatigue, brain fog, or low energy long before lab results look alarming. What concerns me most is how normalized this sign has become. People cover it with concealer instead of asking why it's there in the first place. And this is where the story matters, because when dark circles persist despite rest, hydration, and skincare, they're rarely just cosmetic. They're often an early warning that your internal filtration system is under strain. But recognizing this still isn't enough, because the next sign doesn't show up on your face at all. It shows up lower in the body, and when it appears, kidney stress is already moving into a more dangerous phase. After noticing changes around the eyes, many people still don't connect the dots until the swelling starts to show up lower in the body, especially in the feet and ankles. As a physician, I often hear patients say, "Doctor, my shoes just feel tighter at night," or "I thought this was just from standing too long." But clinically, that kind of swelling tells a much deeper story. When your kidneys are healthy, they constantly balance fluid levels and push excess water back into circulation so it can be eliminated. But when filtration weakens, gravity takes over, pulling fluid down into the lowest parts of the body. This is why ankle and foot swelling often worsens by the end of the day and may leave a dent when you press on the skin, a classic sign we call pitting edema. From a scientific standpoint, reduced kidney function disrupts sodium handling and blood protein balance, both of which allow fluid to leak out of blood vessels and pool in surrounding tissues, and studies show that this type of swelling is strongly associated with declining kidney filtration, especially when it appears on both sides. What worries me most is how often this sign is normalized or blamed on aging circulation or long workdays, because once swelling becomes persistent, it usually means the kidneys have been struggling silently for much longer than people realize. But even this isn't the most overlooked warning, because the next sign doesn't show up on your skin at all. It shows up on the scale, and most people completely misunderstand what it means. After swelling shows up in the feet and ankles, many people step on the scale in panic because the number suddenly jumps. As a physician, I often hear patients say, "Doctor, I gained 5 pounds in a week, but I didn't change how I eat." And this is where misunderstanding becomes dangerous. Clinically rapid weight gain over days or weeks is rarely fat. Fat takes time to accumulate. What's happening instead is fluid retention, water trapped in the body because the kidneys are no longer filtering and releasing excess fluid efficiently. From a medical standpoint, when kidney function declines, sodium balance becomes unstable blood, proteins like albumin drop, and fluid leaks out of blood vessels into surrounding tissues, silently increasing body weight without changing body shape in the way fat does. Research consistently shows that sudden, unexplained weight gain is strongly associated with worsening kidney filtration and often appears alongside edema long before patients are formally diagnosed. What concerns me most is that many people respond by dieting harder or exercising more, never realizing the scale isn't measuring fat, it's measuring kidney stress. And when fluid weight keeps creeping up, it usually means the kidneys have already lost more functional reserve than people expect. But even this sign can still be misunderstood, because the next warning doesn't show up on the scale or the skin, it shows up in the bathroom. And once you see it, the message from your kidneys becomes impossible to ignore. After sudden weight gain from trapped fluid, the next warning sign often appears in a place most people don't like to talk about: the toilet. As a physician, I've had countless patients lower their voice and say, "Doctor, my urine looks really foamy, but I didn't think it mattered," and that moment always concerns me, because medically persistent foam in the urine is one of the clearest visible signs that the kidney's filtration barrier is being damaged. Healthy kidneys are designed to keep valuable proteins, especially albumin, inside the bloodstream. But when the tiny filtering units called nephrons begin to break down, protein starts leaking into the urine, creating thick, long-lasting foam that doesn't disappear after a few seconds. From a scientific standpoint, this condition is known as proteinuria, and large population studies show it is strongly linked to faster kidney function, decline, higher cardiovascular risk, and progression toward chronic kidney disease if left unaddressed. What makes this sign especially dangerous is how easy it is to ignore. Many people blame dehydration, supplements, or just a strong stream, while the kidneys are quietly losing one of their most important protective proteins. And when protein leakage becomes consistent, it often means structural damage is already underway inside the kidney's filtering system. But even this warning isn't the most alarming yet, because the next sign doesn't just change how urine looks, it changes its color. And that shift can signal a much more serious stage of kidney stress. After noticing persistent foam in the urine, the next change many people quietly observe is the color. And this is where kidney stress becomes harder to dismiss. As a physician, I've had patients tell me, "Doctor, I thought I was just dehydrated," when their urine stayed dark yellow or amber day after day, even though they were drinking water. Clinically, urine color reflects how well the kidneys dilute and flush waste. And when kidney function declines, that dilution process weakens, allowing waste products and pigments to become more concentrated. From a scientific standpoint, impaired filtration reduces the kidney's ability to balance fluids and electrolytes, leading to darker urine that doesn't improve consistently with hydration, a pattern that studies associate with declining glomerular filtration and increased toxin buildup in the bloodstream. What concerns me most is that people often normalize this sign assuming it's harmless, when in reality, persistent dark urine can signal that the kidneys are struggling to do one of their most basic jobs, clearing waste efficiently. And when urine color remains unusually dark without a clear explanation, it often means the body's already compensating for reduced kidney reserve. But even this warning can still be overlooked because the next sign is far more alarming. It's not just darker urine. It's urine that changes color because blood has entered the picture, and that's when the situation becomes truly urgent. After urine becomes darker and more concentrated, there's a change that instantly shifts the conversation from maybe to this needs attention now, and that's blood in the urine. As a physician, I've seen the fear in patients' eyes when they say, "Doctor, I noticed pink or reddish urine, but it went away," and that temporary disappearance is exactly what makes this sign so dangerous. Medically, blood in the urine, whether visible or microscopic, means the kidney's filtration barrier or urinary tract has been compromised, allowing red blood cells to leak where they should never be. From a scientific perspective, this can occur when inflammation, infection stones, or progressive kidney damage disrupt the delicate capillaries inside the nephron. And studies show that hematuria is strongly associated with faster kidney function decline when ignored. What worries me most is how often people wait for it to happen again before seeking help, assuming that if it stopped, it must be fine, when in reality, intermittent bleeding can signal ongoing structural stress inside the kidneys. This is no longer a subtle hint, it's a clear warning that something inside the filtration system is breaking down. But even this alarming sign doesn't tell the whole story, because the next warning doesn't show up in the urine at all. It shows up on your skin, and it's one of the most uncomfortable signals your kidneys can send. After blood shows up in the urine and grabs people's attention, there's another warning that's far more uncomfortable and often far more misunderstood: persistent itching. As a physician, I hear patients say, "Doctor, my skin just won't stop itching," but there's no rash, and many assume it's allergies, dry air, or a new soap. Clinically unexplained itching can be a sign that waste products are building up in the bloodstream because the kidneys are no longer filtering them efficiently. When toxins like urea and other metabolic byproducts accumulate, the body looks for alternate exit routes, and the skin, our largest organ, often becomes that outlet, triggering deep, relentless itching that creams and antihistamines barely touch. From a scientific standpoint, studies on chronic kidney disease show a strong association between declining filtration and pruritus, especially as waste clearance worsens, which explains why this itching often intensifies at night and disrupts sleep. What concerns me most is how easily this sign is dismissed, because when kidney-related itching appears, it usually means toxin levels have already been elevated for some time. And while itching may seem less dramatic than blood in the urine, it's often a sign that internal balance is breaking down in a much broader way. But even this doesn't stop there, because the next warning sign doesn't just make you uncomfortable, it changes how your skin actually looks. And that visual shift tells an even deeper story about kidney stress. After persistent itching begins to wear people down, another change quietly appears, and this one shows up the moment you look in the mirror: pale, dull, lifeless skin. As a physician, I've had patients say, "Doctor, I just don't look like myself anymore." And that observation is often more accurate than they realize. Clinically, when kidney function declines, the entire blood system is affected. Waste builds up red blood, cell production can slow, and oxygen delivery to tissues becomes less efficient, all of which can strip the skin of its healthy color and glow. From a scientific standpoint, the kidneys play a role in signaling the production of erythropoietin, a hormone essential for making red blood cells, and research shows that reduced kidney function is closely linked to anemia and impaired circulation, which helps explain why the skin can appear pale grayish or chronically fatigued. What concerns me most is how often this sign is brushed off as stress or aging, when in reality it may be a visible reflection of deeper metabolic and circulatory imbalance driven by kidney strain. And when skin loses its vitality for no clear reason, it's often a sign that the blood itself isn't being supported the way it should be. But even this visual change isn't the most deceptive warning, because the next sign doesn't fade or dull, it leaves marks appearing suddenly and easily, and many people never question why. After the skin starts to look pale and drained of color, another sign often appears that feels small, but medically it's anything but bruises that show up too easily. As a physician, I've had patients point to their arms or legs and say, "Doctor, I don't even remember hitting anything yet. Dark marks keep appearing." Clinically easy bruising can signal that the blood's ability to clot and repair tiny vessel damage is being compromised, a process that's closely tied to kidney health. When kidneys are under stress, waste products accumulate, platelet function can be altered, and the balance of clotting factors becomes unstable, making blood vessels more fragile and prone to leaking under minimal pressure. From a scientific perspective, studies show that declining kidney function is associated with platelet dysfunction and increased bleeding risk even before kidney disease reaches an advanced stage. What concerns me most is how often this sign is dismissed as thin skin or aging, when in reality it may reflect a deeper breakdown in how the kidneys support blood chemistry and vessel integrity. And when bruises begin appearing without a clear cause, it's often a sign that internal balance is slipping quietly out of control. But even this isn't the most misleading warning, because the next sign doesn't show up on the skin at all. It shows up in how much urine your body's producing, and that change can be dangerously easy to miss. After unexplained bruising raises concerns about blood balance. Another warning sign often slips by unnoticed because people assume it's normal you're simply urinating less. As a physician, I often hear patients say, "Doctor, I'm drinking water, but I don't feel the urge to go as often," and many don't realize how serious that can be. Clinically healthy kidneys continuously filter blood and produce urine as a way to remove waste and excess fluid, but when kidney function declines, that process slows down and urine output can drop even when fluid intake hasn't changed. From a scientific standpoint, reduced urine output may reflect decreased glomerular filtration, hormonal imbalance in fluid regulation, or the kidneys entering a conservation mode to cope with internal stress, and studies show this change often appears before patients feel severe symptoms. What worries me most is that people sometimes interpret less urination as a sign of better hydration, when in reality it can mean waste and fluid are being retained inside the body instead of eliminated. And when the body starts holding back rather than letting go, it's usually because the kidneys no longer have the reserve they once did. But this is still only part of the picture, because the next sign doesn't just affect how often you urinate, it affects how you feel every single day, draining your energy in a way rest alone can't fix. After noticing you're urinating less, many people begin to feel something harder to explain, but impossible to ignore: constant deep fatigue. As a physician, I often hear patients say, "Doctor, I'm exhausted all the time, even after a full night's sleep," and they worry it's depression, aging, or burnout. Clinically, chronic kidney stress can quietly drain energy because waste products that should be filtered out begin to circulate in the blood, interfering with muscle function, brain clarity, and cellular energy production. From a scientific perspective, declining kidney function is linked to toxin buildup, electrolyte imbalance, and reduced red blood cell production, all of which limit oxygen delivery and ATP generation at the cellular level, explaining why this fatigue feels different from normal tiredness. It's heavier, persistent, and doesn't resolve with rest. What concerns me most is how often people push through it, blaming themselves for being lazy, when in reality their body's working overtime to compensate for failing filtration. And when fatigue becomes your new normal, it's often a sign that the kidneys have been under strain far longer than you realize. But even this draining exhaustion isn't the final clue, because the next warning sign often shows up at night, disrupting rest itself, and it's one many patients never connect to kidney health. After constant fatigue sets in, many people notice something strange happening at night: an uncomfortable urge to move their legs, sudden muscle tightness, or sharp cramps that pull them out of sleep. As a physician, I've had patients tell me, "Doctor, I can't relax my legs at night and my calves cramp for no reason," and they often assume it's dehydration or aging. Clinically, this can be a sign that kidney stress is disrupting nerve and muscle signaling. When kidneys aren't regulating electrolytes properly, especially magnesium, calcium, and potassium, nerve impulses become unstable, muscles contract involuntarily, and conditions like restless leg syndrome or nighttime cramps become more common. From a scientific standpoint, studies show higher rates of restless legs and muscle cramping in people with declining kidney function, even before advanced disease is diagnosed, highlighting how sensitive the nervous system is to subtle filtration changes. What concerns me most is how often people try to stretch it away or ignore it when in reality these nighttime symptoms can be early warnings that internal balance is slipping out of range. And when sleep itself becomes restless because your nerves won't calm down, it's often a sign that kidney stress is no longer staying silent. But even this isn't the last signal the body sends, because the next warning doesn't disturb your sleep. It slowly takes away your appetite, changing how your body responds to food in ways many people never expect. After nights disrupted by restless legs and muscle cramps, many people wake up to another confusing change. They simply don't feel like eating. As a physician, I often hear patients say, "Doctor, I'm not trying to diet, I just don't feel hungry anymore." And they're surprised when I take that seriously. Clinically declining kidney function can alter appetite because waste products that should be filtered out begin to affect the digestive system and the brain's hunger centers, subtly suppressing normal signals of hunger. From a scientific standpoint, studies show that toxin buildup and metabolic imbalance in kidney stress can interfere with gut hormones, taste perception, and even cause low-grade nausea, making food suddenly less appealing even when the body actually needs nourishment. What concerns me most is that people often see this as a benefit, eating less, losing weight, without realizing it may be a warning that internal chemistry is shifting in the wrong direction. And when appetite fades without a clear explanation, it's often a sign that the kidneys are struggling to maintain balance behind the scenes. But this still isn't the final clue, because the next sign doesn't change how you feel about food, it changes how your body smells. And that's a signal many patients find deeply unsettling. After appetite quietly fades, there's another sign that many patients find embarrassing, but medically it's incredibly revealing: persistent bad breath or a strange metallic taste in the mouth. As a physician, I've had patients lean in and whisper, "Doctor, no matter how much I brush, my breath still smells off," and they worry it's a dental issue. Clinically, when kidney function declines, waste products like urea begin to accumulate in the blood and can be released through the lungs and saliva, creating what doctors sometimes call a uremic or ammonia-like breath. From a scientific standpoint, research shows that reduced kidney filtration allows nitrogen-based toxins to circulate longer, altering taste receptors in oral chemistry, which explains why food may taste metallic or unpleasant even when nothing has changed in the diet. What concerns me most is how often people try to mask this sign with mints or mouthwash, never realizing it's not coming from the mouth at all, it's coming from the bloodstream. And when the body starts releasing waste through alternate routes, it's a clear signal that the kidneys are no longer keeping up with their workload. But even this unmistakable warning isn't the last one, because the next sign doesn't affect your breath or taste. It shows up in your hands and nails, quietly reflecting long-term metabolic stress. After changes in breath and taste hint that waste is building up internally, the body sends a quieter, slower signal, one that shows up right at your fingertips. As a physician, I've had patients hold out their hands and ask, "Doctor, why do my nails look so different now? Ridges appearing, nails becoming brittle, pale, or discolored over time." Clinically, nails grow slowly and reflect long-term metabolic health, which is why kidney stress often leaves visible marks there. When kidney function declines, mineral balance, protein availability, and blood oxygen delivery are disrupted. And over months, this affects nail formation, leading to vertical ridges, thinning, or changes in color that don't improve with supplements or nail care. From a scientific standpoint, studies link chronic kidney dysfunction with altered calcium, iron, and protein metabolism, all of which play a role in healthy nail growth, making the nails a kind of timeline of what the body has been enduring beneath the surface. What concerns me most is that people see nail changes as cosmetic or trivial, when in reality they often reflect prolonged internal imbalance rather than a sudden issue. And when signs show up in something as slow-growing as nails, it usually means the kidneys have been under strain for much longer than anyone realizes. But even this isn't the final message your body sends, because the next warning doesn't develop slowly. It shows up as swelling in places you use every day, and it can change how your hands feel almost overnight. After long-term stress starts showing up in the nails, many people notice something far more immediate and disruptive: swelling in the hands and fingers. As a physician, I often hear patients say, "Doctor, my rings don't fit anymore. Or my fingers feel stiff and painful in the morning, and they assume it's arthritis or simple inflammation. Clinically, swelling in the hands signals that fluid retention has progressed beyond the lower body and is now affecting areas closer to the heart, which is a more concerning stage of imbalance. When kidney filtration weakens excess sodium and water remain trapped in the bloodstream, and as pressure builds, fluid leaks into soft tissues of the hands, making fingers feel tight, achy, and less flexible. From a scientific standpoint, studies show that bilateral hand swelling, especially when it's worse in the morning, is strongly associated with impaired fluid regulation and declining kidney reserve, not just joint issues. What concerns me most is how often people force their hands to warm up or wait for the swelling to go down, when in reality, this is the body signaling that fluid control systems are no longer keeping up. And when swelling reaches the hands, it often means the kidneys have been under sustained strain for quite some time. But even this isn't the final warning, because the next sign doesn't just affect how your hands feel, it changes how your entire body weight fluctuates, often in a way that seems sudden and confusing. After swelling begins to affect the hands and fingers, many people step on the scale and feel completely confused because their weight seems to rise and fall without any clear reason. As a physician, I often hear patients say, "Doctor, I gained 3 or 4 pounds overnight, then lose it days later," and they assume it's diet, hormones, or water intake. Clinically, this kind of rapid weight fluctuation is rarely about fat. Fat doesn't appear or disappear that quickly. What's happening instead is fluid shifting in and out of the body because the kidneys are no longer regulating water and sodium consistently. When filtration becomes unstable, the body may retain fluid one day and partially release it the next, causing sudden changes on the scale that feel unpredictable and unsettling. From a scientific standpoint, studies show that impaired kidney function disrupts fluid homeostasis, leading to short-term weight swings that often precede more obvious signs of chronic kidney disease. What concerns me most is how often people respond by dieting harder or cutting calories, not realizing the scale is reflecting kidney stress, not body fat. And when weight starts fluctuating without a clear pattern, it's often a sign that the kidneys are losing their ability to maintain internal balance. But even knowing all of these signs still isn't the most important part, because there is one final truth, something most people never hear that can determine whether kidney damage progresses or can still be slowed down. Before we end, I want you to hear this clearly and calmly. If you recognize yourself in any of these signs, it does not mean you're out of options. I've seen many patients feel afraid at first, then regain control simply by understanding what their body was trying to say and acting early. Your kidneys are resilient organs, and when you support them with the right habits, the right nutrition, and the right timing, you give them a real chance to stabilize and protect what function remains. You are not weak for noticing symptoms, you are strong for paying attention. If this video helped you understand your body better, please save it so you can come back to it and subscribe to the channel to receive the latest science-based medical knowledge about kidney health explained in a way that's practical, honest, and meant to protect you, not scare you. I share these videos because I truly care about helping you avoid the road so many people never knew they were on until it was too late. And remember, this kidney damage does not happen overnight, and neither does healing. But every small informed choice you make starting today can change the direction of your health tomorrow. Stay with me, keep learning, and take care of your kidneys because they work for you every single day, often without asking for anything in return.